Before we jump into this episode, I want to remind you that while Caitlin and Sophia are dietitians, we're not your dietitians. This means the information shared in the Food Freedom Fertility podcast is intended to entertain, educate, and inform. It is not a substitute for medical care. This information is not intended to diagnose, manage, or treat disease. Always consult with your doctor before making any changes.
Welcome to another episode of Food Freedom and Fertility. This is one of those Win Wednesday episodes where we are going to highlight a fertility story with someone that Sophia and I have worked with who has listened to the podcast or been a part of the community in some way. So if you're listening to this and you're thinking, man, my story should be recorded and I think it could be encouraging to people, and you haven't worked with Sophia or I, you're listening to this episode, that means you're part of the community. And send us a DM and we'll get you the link to kind of send us your information so we can get it on the books if it's a good match. So here we are, and I am very overjoyed to welcome Callie to the podcast. Callie was a gal that worked with me back in 2023. Starting kind of around January-ish of 2023 in a group coaching format that came with 4 one-on-one sessions. So she kind of got a nearly weekly call with a group of women, and then she and I got to hang out one-on-one and kind of individualize things. And she's here today, very generous with her time and her heart and her story, to provide some hope and some community for you all. So welcome, Callie.
Yeah, thank you so much for having me today.
Callie, can you give us a little bit of like a overview, like if we were sitting in a movie theater and the preview we were watching was your fertility story? And you're welcome to give away spoilers because this isn't a movie theater and a preview, but like high level, 10,000 foot view, what did your fertility story look like?
Yeah, well, I guess is it okay to mention kind of
All the
way
way.
back in high school when
Yeah. Oh,
I
yeah.
was diagnosed? Okay. So, I was diagnosed with PCOS in high school, and it started when my mom actually noticed some longer hairs on my chin, and she kind of pointed them out to me, and she has some connections to electrology and had just asked like, hey, I noticed this. Do you want to go to electrolysis and get some help with that? I don't know if it bothers you or not. And she was very, cautious asking me, and she didn't want to offend me. Um, and to be honest, I didn't really notice right away, but I did go with her, and I went to electrolysis for the first time. And the esthetician, after working with me, she said, you may want to go get your hormones checked. These hairs look a little more coarse and dark. And so I kind of was maybe a little caught off guard. I'm like, oh, okay, well, this was something I wasn't super focused on, but it kind of came to light. So we went through the primary care journey of going to talking to my family practitioner, and she directed me to an endocrinologist, and we did a series of lab work. I do live in Minnesota, and the clinic I went to is connected to the Mayo Clinic. So I went to Rochester Mayo Clinic to have this done. It was very close to my house, and um, did a series of lab work. I also had some MRIs done, some CTs done. They, go through the whole gamut of trying to rule out other diagnoses that could look like what's going on now. And after my lab work, I didn't have any elevated testosterone at the time. I did have elevated androgens in the androstenedione was elevated. And then just a presentation with the hirsutism. And then I did have a like cyst that was shown on my ovaries or the follicles. And so throughout everything and ruling out like tumors of the prolactin or from prolactin, um, they came to the conclusion that it was a PCOS, most likely attributed to that. And they connected me with a birth control pill and said that if I down the road struggled with weight, that we'd talk about metformin. If I struggled with sugars, metformin. And then they said I could potentially have difficulty with conceiving someday and just to come back if that's an issue. So kind of a very similar story to I think many women out there as far as like the talk about fertility and PCOS.
I want to take a minute out of this episode and talk to you about our partner, Fertility Cloud. We decided to partner with Fertility Cloud this season because we have worked with women all over the nation and we have heard the same issues arise again and again. My doctor can't see me for another 8 weeks. I had to wait 3 months to see a specialist, and even then, they didn't really tell me anything. Or there's no one in my small town that knows anything about my situation or can help me. And that's so common because unless you live in a major metropolitan area or a place that has grand medical universities, and honestly, sometimes even then it's still an issue, it's really hard to find fertility specialists who can give you tailored, customized help for your unique fertility situation. And that, my friend, is exactly what Fertility Cloud does for you. They offer everything you need, but right in your home because it's fully online. Another perk is they often have same day or next day appointments, so no waiting weeks and weeks and weeks in order to be seen by someone. And my favorite thing of all, really the pièce de résistance and the reason we are partnered with Fertility Cloud for this season, is they have a love and a passion for helping families grow. It is why they do what they do. It is why they wake up in the morning. It is why they have this world-class staff who cannot wait to step in and help you along your journey. So if this sounds like what you have been dreaming of, click the link in our show notes and go to fertilitycloud.com for $50 off your first visit.
But I felt like overall there was they really looked into things for me, so I felt very lucky to have had that expansive diagnostic assessment for that. So then I went on the oral birth control pill. At the time, I didn't really question anything. I just didn't really want hair on my face. And at the
Do you know
time,
how old you were at that point? You mentioned you're in high school, like early high school, late high school?
I was, I think, about 16 at the time.
Okay.
So it was like 16 or 17, I think. I was like in my junior, senior
Mm-hmm.
year. So maybe like 17. Um, and my periods were irregular at the time, which I didn't really mind too much because it was nice not having to deal with that.
Right.
Um, I was very involved in sports and athletics and music, and I was very busy. And so I didn't think twice about not having a regular period at that point. So I went on the birth control pill, and it somewhat helped, I think, the hair growth. But again, I didn't really think too much of my cycle during those years. I went to college, and then after college, I started having to pick up my own prescriptions. I was on my own, and at that point, I think I went off the birth control pill because I'm like, I don't know if I need this anymore. I'll just go off of it, and then about 6 months go by, and kind of noticed the hair growth picked up a bit, and I wasn't getting a period. I'm like, this is interesting, and um, I did I did graduate with my registered nursing degree, my bachelor's in that. So, working in a nursing profession, I started becoming a little more in tune with healthcare and then started applying it to myself. And so I said, oh, well, I didn't get a period. This is probably something I should look into. Um, so that prompted me to go back to primary care and was started again on birth control pill. And then I was set up again with an electrolysis. Um, so once I did that, I stuck with it for a number of years, and I didn't think much about fertility until after I was married. For about a year, we were kind of like, let's just take the year, not think about kids. And I was on the birth control pills, so that was helpful in that regard. And I was taking it more so for hormone imbalance. Um, and so then a year went by, and I thought, well, maybe I should see what my body does without the pill on board. And so I went to my primary care, and they said that before we were interested to try conceiving to stop it for 3 months and just see what your body naturally does. So that's what I did. And the first month went by and 35 days went by, and then I had got my period at that point. I'm like, oh, okay, well, maybe my body's
That's
getting
fairly
back in the
regular.
groove.
Yeah.
Yeah, that's not
Hmm.
too bad. And like I said before, when I was like just post-college,
Mm-hmm.
and this was back in like 2013 or so, just to kind of give a time reference for people. Um, I had gone like 6 months without getting a period. So thought, oh, 35 days, that's not bad. Then the next month went by and it was like 40 days. So I'm like, okay, well, kind of somewhat close. I started to investigate more about how to look at your cycle and different phases and got connected to different podcasts out there. I listened a lot to, I think it's called Friday Fertility or
Fertility Friday with
Fertility.
Lisa Hendrickson, Jack.
Yeah, yeah.
Yeah.
So I listened to like a lot of her podcasts and tried to
Such a
educate
great
myself.
podcast. Like she's
Yes.
wonderful. I When I was thinking about starting a podcast, that was when I listened to it and thought like, you have those like role models in different areas of life. It's like when I grow up, I want to be like her. I still feel that way about her. She and Lily Nichols just co-authored a book, Real Food for Fertility, and she handles like the cycle side of that. Great book that I highly
Okay.
recommend too. So that's a great,
Yeah.
it's a good stepping stone and a great podcast to shout out.
Yeah. 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 And then I throughout that process, oh, and I will like say too, just for people who maybe aren't in the medical field, I was a registered nurse and I still am today, but I also went back to grad school and got my doctorate in nursing practice. So I'm a psychiatric nurse practitioner. And throughout my schooling, we had some knowledge of the menstrual cycle and what happened. Like in my pathophysiology course, we learned kind of about the different hormones going on, but not super in depth, and it was kind of glossed over, I felt like. So it was very enlightening to me to learn this and learn about how at different stages of your cycle you might feel a little more energy at different stages. Um, so throughout that podcast journey, I listened to more and more different podcasts, and then I found myself really going to the PCOS ones more because during that time my cycle kept getting longer and longer. And so I had the 35-day cycle, the 40-day cycle, and then it was a 60-day cycle. So as I was learning, I'm like, well, this isn't going in the right direction here. And I need to figure out how can I shorten this.
Were there times in there where you thought, oh, maybe I'm pregnant because like your period, you were expecting it 35, 40 days and then it didn't show up for another 3 weeks or so?
Um, I don't think so, primarily because what I was learning about how to look for ovulation, when I was seeing those things, it wouldn't add up with,
Like when intimacy just
yeah, when
happened to
that was.
happen.
Yeah.
Okay.
And then also one thing that I was learning about my cycle was it always seemed as though my body was trying to ovulate. Like I kept getting these patches of cervical mucus happen where I saw the clear, stretchy cervical mucus and then it didn't happen. Nothing would happen. And I was taking my temperature, so I was kind of looking at all these different measures to look into that. And So I don't think that ever really crossed my mind at the time. And I was also taking like the OPCs too, and
Did you
that's what they're
see
called, right? OPCs.
OPKs? But
OPKs,
yeah,
yes. Yep.
um, ovulation predictor kit. So were you seeing positives with your ovulation predictor kit? Like, were you seeing your body was about to ovulate ever?
I saw the because that looks at LH in your
Mm-hmm.
system. I saw it get kind of somewhat darker, but it wasn't a positive.
Mm-hmm.
Um, yeah, so I kept going and listening to the PCOS specific
Podcasts.
podcasts.
Which ones
Yep.
were you listening to?
Oh,
There's a
I should
couple,
have.
like PCOS Diva is one of them. The PCOS nutritionist, she's out of New Zealand. She's a great resource. I love her.
Yeah.
Claire.
I these are all sounding very familiar.
There's a
Um,
couple, the PCOS girls or gals podcast. There are a couple Australian gals
yes,
that
I
have
listened to
PCOS.
that. Yep.
Mm-hmm.
I listened to that. I listened to well, I eventually found your podcast, and so I was listening to a podcast and um I wasn't always following the shows. I was just kind of looking for the title names. But then I saw you or I heard you on one of the podcasts and I really was drawn to listening to you, just your style and coming from a science background. I really appreciated the evidence-based research that you pulled into things. And I also appreciated your stories of working with your clients because I felt like, oh wow, this dietitian really cares about the people she's working with. And then also I'm not sure if I knew it at that point or after looking you up and finding your podcast, did I find that you bring faith into the mix too, and that was really appealing to me. So then I got on the train of listening to a lot of your podcasts too, and that was part of the journey. So I was doing a lot of like self-knowledge, and I think I actually reached out to you at one point, wondering if I could work with you, and I think that might have been like a time you were on.
Maternity leave. After
Yeah.
after my third baby and after my second, I took 6 months off completely. After
Hmm.
my third baby, I didn't do appointments for a whole year. And it was just kind of like what I knew my bandwidth was. So I'm sure it was probably in one of
Hmm.
those windows.
Yeah. Yep. I think it was. Um, but then I'll get to the part where we connect in a
Mm-hmm.
little bit. So this was just like a couple months before you advertised your group class.
Mm-hmm.
Um, so at that point, I did see a primary care when my cycle was like getting to 2 months out. And I looked up different people in my community and just went with somebody that had a special interest in PCOS. And I went, and she was very nice and kind. It wasn't as much as I was hoping for out of an appointment, um, but she did direct me to the supplement, the inositols. She kind of recommended that, and then directed me to some more resources to look into. And she was also very kind of pulling different labs for me that I was looking for. One of the ones that she recommended actually was to look at my AMH level. And so um, that was elevated. I think it was like, you wrote this down.
Higher teens, maybe. I'm trying to remember. So while she
Yeah,
looks it up, AMH is
yeah.
anti-Müllerian hormone, and it is something that follicles that are kind of maturing to get to the point of ovulation put off. And in the fertility world, we're often looking at AMH for what we would call a surrogate marker. So it's like in the place of, kind of, and typically denotes something about your ovarian reserve. As you age, you have follicles that you use, and then you have follicles that just kind of like dissolve, essentially. Like they are not going to be used for ovulation or getting you to ovulation. And as you age, the amount of eggs that you have every cycle that you pull from and start maturing diminishes. And so as you have less every cycle starting to mature to hopefully one become the ovulatory follicle, you have like maybe at the beginning, I'm just going to use numbers for fun. When you're 16, maybe you have 30. When you're late 30s, 38, 40, early 40s, maybe you have 10. Okay, so you have less of these follicles emitting this hormone. And so over time, the hormone goes down. Hey, thanks for tuning into this episode. We're so glad that you're here, and we want to take a moment and share with you about one of our sponsors, Fullwell. Fullwell is a reproductive health company that offers superior nutritional supplements made without any compromise to support women and men throughout the reproductive journey. And today, I want to take a minute and tell you a little bit about one of their products called Iron Bump. Iron Bump is a favorite product of mine because not everybody needs iron support while they're trying to conceive, while they're pregnant. And because of this, I tend to recommend really high quality prenatals that don't have iron in them. But there are instances where you want some iron. When you're in one of those instances, this is a great product to turn to. And let me tell you why. This iron product contains ferrous biglycinate. It's a better option than most of the conventionally used iron salts, as it's been shown to be at least 2-fold higher bioavailability and absorption and has less digestive side effects. This product also is combined with some other supports that make it really helpful when you're taking iron. Many people, when they take iron, have digestive side effects, and part of that comes because it's a harder thing to digest. And Fullwell covered for that. They included in the supplement acerola cherry, which is a rich source of vitamin C. For iron to be absorbed properly, it needs an acidic environment in the GI tract to do that. And vitamin C helps create this environment. Fullwell's put a lot of thought into this digestive comfort blend so you absorb what you need and have a comfortable time doing that. So head over to fullwellfertility.com and use the code FFF20 for 20% off your first order. And now back to our episode. And that gives us a view into how many follicles you have. With PCOS and with a couple other conditions, it's not great for that because we tend to kind of gather more follicles in this maturing process, but then they get kind of stuck in this particular part of the maturing process that allows them to emit a lot of this hormone, but they're not actually maturing for ovulation. So it's like, I always like to describe it as like you got that like 14-year-old boy, 12-year-old boy stuck in that phase of his life where he's like, his voice is changing and he's so uncomfortable, like afraid to speak or sing or do anything because he's just like, his voice cracks. It's like that. The AMH is that voice cracking and you just have that like raging hormone, but you're stuck. So usually in PCOS, we see higher levels of this. Which a lot of people can be like, great, I have a lot of eggs. And that can very well be true. But usually what it means is your ovaries at this point are typically pretty polycystic. There's a lot of stunted in their process follicles. So I love when doctors are pulling this, especially when somebody's looking into fertility. We're starting to see it a lot more because in the most recent clinical guidelines for treating PCOS and the diagnostic piece of it, especially in younger women, they're talking about using AMH instead of ultrasound to kind of check the box of are there polycystic ovaries, especially in women younger than 18. Like there's no reason really. There's no reason. There are limited times where you should have a transvaginal ultrasound where they use a wand and go up into your vagina. That's how they look at cysts on your ovaries. And so drawing this blood is really, truly much less invasive for most people.
Yeah. Yeah, I was able to look at that up. It was 18.9 was mine. And
so that's pretty high for your age.
Yeah. Yeah,
How
and I
old
was
were you when was that drawn?
yeah, I was 32 during that time.
So usually, just to give people context, it changes with your age, but somewhere between like 1.5 to maybe 10 is like somewhat typical for us to look at the whole of your fertile years.
Hmm.
So she's almost
Yeah.
double that, which tells us,
Yeah.
it gives us like a view into her ovaries at that moment.
Hmm. Yep. Yeah. So like I said, after that, I wasn't completely satisfied with what I was looking for. I was still wanting like more. I was wanting answers. And, you know, a lot of when I was starting to look at things, I heard from different podcasters about different forms of PCOS. And throughout my life, when I would tell providers that I had PCOS, sometimes they'd question me because I didn't always fit the mold of what the like classical presentation of PCOS, um, which it was kind of discouraging to hear that sometimes because um, I, I was having these concerns with my hair growth. For one, that was like always my biggest thing. And then um, as I started getting off birth control, the regularity of my cycle was also a concern, and I kind of wanted to figure out how can I fix this? That's
Yeah.
at the end of the day, I didn't want to be just turned away and said, "Well, do you really have PCOS?" Um, so I forget where I was going with that
Can I
tangent.
interject a little bit?
Yeah.
If you're not
Yep.
watching us on YouTube, and I hope you're okay with me saying this. If not, we can cut it out. But um, weight bias is a huge piece of the PCOS community, both with diagnosis, both with attitudes towards how compliant patients are with treatment protocols. And Callie kind of where she may not fit the mold is she's not coming in with this like very overt and physically um like outward appearance of high levels of insulin. Is that fair?
Hmm.
Not really been a huge struggle with your weight in your life. You've always been
Hmm.
very active. Maybe we'll talk about that part of your story, but um, a lot of times I've even had doctors say to me in my own body at various points in my life, like, you don't have PCOS because you're not overweight.
Yeah.
And that is not a diagnostic criteria or an exclusion criteria for this syndrome. It's just not. So if you've been told that I'm sorry, because just because you look one way or don't look one way, it doesn't matter really.
Hmm.
We're looking at symptoms, we're looking at health history, we're looking at family history. We should be asking many more questions and not making swift judgments just based on the size of your body at any given time.
Hmm. Yeah. And I think it really just speaks to the lack of knowledge of the general community of PCOS too. And um, so just having that experience, it really opens my eyes as a practitioner about other people I work with and how you respond to things that they bring forward and their concerns they have. Um, so in my journey, I then kind of went to a functional medicine provider and wanted just like a more in-depth look at my hormone panel. And so then I found someone and she was great and she got me connected with some different supplements that I should try. I also at the time went to see an acupuncturist because I think I may have gotten that recommendation from you, Caitlin, on your podcast. I think you had maybe mentioned that. Um, and so I
I
felt
love
pretty good about the
acupuncture.
team that I had working with me. At that point, my husband and I, this was about winter time in Minnesota, and we were not super fans of the winter. We love Minnesota in the summertime. Our families are here, so there's a lot that pull us here, but winters is not one of them. So we had a fun, both of us are able to work remotely. So this was kind of a really fun thing for us and kind of a self-care thing too, as we went down to Florida for a couple months and worked from Florida. And kind of looking back, I think that was um, a very pivotal time for self-care for me. I was able to really pull away from lots of the hustle and bustle of everyday life. And it was just my husband and I. We did a lot of things outside. I was able to do a lot of quiet time in the mornings, devotion, prayer, journaling. And I think for me, what I've learned about myself is that being someone highly motivated, I like this term that someone used, I'm going to use it, a recovering perfectionist. Someone who is a little more, I wouldn't say I'm high strung, but I do like to push myself. And so this was a time for me to relax and practice mindfulness and take a step back and calm. And I think that really added to my fertility journey as well. And so during this time, that's when Caitlin, you advertised for your group class and your one-on-one sessions. And I debated about it for a while. I'm like, do I want to do this or not? Am I doing too much? But I think the piece that really stood out for me, and one thing that I felt working with you was a really big win, was the community aspect that I gained. And working with you, being someone that provided hope and counsel and prayer, and I think just the reassurance that I was doing a lot of good things for my PCOS. And so I think that for me was a big win working with you. Because I did, like I said, I did a lot of self-education and I spent a lot of time, but I think the piece that was missing for me was that community piece and the reassurance and kind of
I
calming
feel
my
lonely.
chatter in my mind.
Yeah.
Yeah.
It can feel
Mm-hmm.
lonely. It can feel alienating. It's like a
Mm-hmm.
time in life where a lot of friends start having babies or you have
Mm-hmm.
nieces and nephews, and then you're the only one in this context of your community, maybe. I love what you mentioned about like that geographical shift, how it almost forced you to kind of slow down and take care of yourself.
Mm-hmm. Yep.
um as soon as you said that, I thought, you don't have a huge community where you went, and so you're driven together, or
Mm-hmm.
you're driven to the area, or you have you, and wherever you choose to allow your heart to commune, right? Like maybe that is journaling and prayer. Maybe that's walking along the beach and watching dolphins jump, which I remember videos of. Like
Yeah.
there is this wide variety of things you actually were able to open yourself up to because you were kind of in this different place.
Mm-hmm. Yeah.
We're taking a quick break from this episode to talk to you about one of our sponsors, NutriSense. NutriSense is sort of a one-stop shop blood sugar nutrition solution that works to help you understand the way foods impact your individual body. So when you use NutriSense, you get a continuous glucose monitor, which helps you see the way that food impacts your blood sugar both immediately and over time. And you get access to a credentialed nutritionist to help you understand these numbers and apply new strategies to your life to help you be your most fertile self while taking care of your body nutritionally. Using a continuous glucose monitor was a game changer for me when I was about 6 months postpartum, and it seemed like my body was just responding differently to the foods that I had sort of always been eating. So NutriSense sent me one of these continuous glucose monitors. I wore it for 2 weeks and was absolutely blown away at the data that I found. Some foods that I thought were great and healthy and doing wonderful things for my body were actually causing huge shifts in blood sugar that were causing me to have all kinds of issues like anxiety and insomnia, and just exacerbating some of the things I was experiencing postpartum. And working with NutriSense helped me not only understand what was going on, but have a plan on how to change the way that I was eating to better support my body in this new situation. Using a continuous glucose monitor for you can really be a game changer in your fertility journey. I mean, imagine having real-time insights on how your body responds to different foods, activities, sleep, stress, all the things that we're constantly harping on this podcast. This can help you make smarter food choices, stay motivated, and understanding your body's unique needs better. So head on over to nutrisense.io/FFF and use the code FFF50 to get $50 off your first month with Nutrisense.
I also, when I look back on that time of community, there's like this push and pull with that a little bit, right? Where it's like, I'm like these people, but am I like all of them? Or the things that apply to them also something that apply to me? Maybe my PCOS is a little bit different. There's a lot of people that talk about types of PCOS. There's a little bit of research around typing PCOS, but it's very different than what you're going to hear on social media. Social media talks about adrenal type and thyroid type and post-pill type, and it kind of has these categories, which the research doesn't really dial in on, but the research does dial in some studies on those that have all three criteria. You don't have a period, you're not ovulating, you have polycystic ovaries, you have signs of hyperandrogenism, or every combination that could give you that diagnosis. So like the cycle irregularity and the hirsutism, the cycle irregularity and the ultrasound, the cycle irregular or the ultrasound and the hirsutism. So like those are the types that research talks about. And then there's some research that will pick us out based on if we're trying to be fertile or not, or based on our weight and BMI. There's not a lot of great research to look at Callie, who didn't have the weight issue, but had the cycle irregularity, had signs of hirsutism, like, what about my type? And so while the community can bring a lot of support, sometimes it's can feel a little bit confusing, because it's like, well, so-and-so should do that. Should I do that? Or I think you're the first one pregnant, which is what happened in our group. Callie was the first one pregnant. And so it's like, should I even be open to share? Should I hold back? Because I was just them, and I know what it feels like to be on this side of it. And so you're always going to struggle with that a little bit in almost any community, especially when you have a common health goal, purpose, and diagnosis. Cancer survivors or people going through cancer treatment right now. Like, you can look at this in a lot of different areas. And so there's a little bit of stress and push and pull. But by and large, I think one thing that's shocked me most about running group programs is that almost everyone leaves it feeling like that was one of the most valuable parts of all.
Yeah. Yeah, there's something about community that is so important in health, I think, and feeling. There's like that. I think of health in many ways, like mental health, spiritual, physical, and then community health is so important and vital. Yeah. And there was one more thing when you were talking about the different PCOS diagnoses, and I think if anyone can relate to this, sometimes it's like, what is the missing piece for me that's going to help me have a normal cycle? Or because I think you can go down the rabbit hole of all these labs too. And for me, my labs, it was really hard a lot of my labs, I say this gracefully, or graciously, but like they were very normal. The biggest one that was out of balance was my testosterone. But my like DHEAS, my insulin, my sugars were always in normal ranges, so it was very like stumping to me. And I think that was a mental battle for me. And so when I finally got to working with you in the group, I think the group helped me just kind of like let go of that pursuit of trying to figure it out, and just saying, I just need to keep working with these tools and let go of what's the magical thing that's missing, and just kind of work with what I know. And the community support, I think that helped me release part of that drive, I guess.
So, when we talk about like entering the group program and like where you were at in terms of you'd come off the pill, you'd had some longer cycles. Like, were you at that point actively trying to conceive, or was that kind of like, we want to get pregnant maybe this summer, or
Yeah.
maybe?
Yeah. So, um, back when I had the 2 month cycle, and I then proceeded to have a 3 month where I didn't have a cycle, and I was given a progesterone pill to help shed the uterine lining. And then at that point, I was connected to my functional medicine provider who had me on the supplements. And then I started getting probably 60-day cycles again. So I was kind of on that process. And my husband and I were at the point where we're not focusing on getting pregnant, but we're open if it happens. It wasn't a lot of pressure. And we kind of said this summer, we'll see how that goes. And if I'm still having troubles with ovulating, maybe we'll kind of take another step to look into things like letrozole or more help and be a little more diligent about it. But this was in the spring of 2023, and we were giving ourselves through, I think, the fall to just kind
Kind
of
of see what happens.
see what happens.
Naturally,
Yep.
no pressure.
Yep.
So, shifting from Callie on birth control, Callie starting to work with functional medicine, you started some supplements. Did the provider or the acupuncturist that you saw start making suggestions in terms of changes to your exercise, changes to your nutrition, changes to other aspects of your lifestyle that might help manage PCOS and favor fertility?
hmm Yeah, I think one of the things that stood out, the acupuncturist that I worked with, we had a couple sessions before I left, and those were great. I felt like I was floating and um, just felt like it was a great time to have an hour where you rest and relax. And so she encouraged me to do that in Florida. We took some time away. She said, I just want you to work on relaxing more, and um, you're doing a lot of great things. So taking that pressure off yourself and just practicing self-care, relaxation, mindfulness. And so I think that's the one thing on that part that she really enforced when we were in Florida.
I remember talking about that with you and talking about just even the side of Florida you were on, right? You were on the west coast of Florida.
hmm
So I lived in Florida from, well, I was born in Orlando. We moved away and moved back from kindergarten to sixth grade. And some of the best sunsets I've seen
Mm.
literally in my entire life are from my childhood in Florida. You've got this like combination of really flat land. Florida's very flat, water, and the horizon. And you can watch the sun. Really, you could be on one side of Florida and see the sunrise, and on the other side of Florida and see the sunset in the same day, and really experience. And I honestly would recommend that to somebody in their lifetime to kind of watch both. Like go to Cape
Mm.
Canaveral, watch something shuttle off into the sky early morning, drive to St. Augustine or somewhere on the west side, and watch the sunsets. And bringing God into this, like he designed sunsets and day and night and what activates energy and what helps our body respond to rest and sleep and recovery within the way light bends at the end of the day. And it's really beautiful. Like if you look at sunsets, they can kind of start in these like rich purpley hues, but end in the very warm, like golden and orange and red. And it literally is like a natural turning melatonin on in your body. It's this beautiful thing that very often, if I get somebody who I can tell stress is a big part of their story and busyness is a big part of their story, or anxiousness is a big part of their story, I will like prescribe, if I could use that term loosely, like watching a few sunsets a week for a while, because the act of being in nature, the act of slowing down, the act of watching the light change and bend in the ways that it does has this incredibly calming effect. And I remember thinking, like, of all the people I could give this recommendation to, I'm so excited to give it to Callie because she's in this spot that just has just the most incredible sunsets.
Mm-hmm. Yeah. Oh,
Like,
yeah.
just go sit and watch them.
Yep. And at that time, there was some dolphins that would come and they would kind of have their dinner, and yeah, it was a really great experience, and it was a really
Special.
nice assignment to get.
Right? Like, yeah, you expect a dietitian to tell you to go eat a lot more broccoli and spinach. Maybe not like go hold your husband's hand and sit by the water and watch a
Yeah.
sunset.
Yeah.
Yeah.
Yep. Yeah, and I think,
So,
yeah.
so shifting a little bit to other parts of lifestyle, talk to me about movement and nourishment in the context of like over time. Callie married, on birth control, getting into functional medicine, listening to all these podcasts, being able to read research on your own. Like how did that kind of morph and change over time?
I think I want to say it wasn't like super drastic changes, but it was like a little bit here and there. I think initially when I started, I tried to be more hyper focused on my diet, and um with time, I found that PCOS plate guidelines that you talk about, the protein and the healthy fats and complex carbs and fiber and color on your plate, that really just stuck with me more, and trying for me at least to have more of a high level thinking when I think about diet. And I think what stuck with me from when I started to now is really that protein piece, is trying to incorporate that into most meals and sustaining. That's the can give you the best sustained energy. Um, and then and I would say now postpartum, we haven't really gotten to that pregnancy piece yet, but postpartum, it's been hard again trying to figure that out and trying to incorporate. It's kind of learning this new way of life and integrating those principles back into today. Um, and then exercise wise, I'd always been very avid, um, probably like 5 to 6 times a week exercise, high intensity, some long distance running. And I put a lot of identity in that. I felt good after it. I liked it. But I tried to slow down a bit in that and tried to reduce the long intense workouts. Um,
Do we exchange them for some yoga at some point or
yeah,
stretching type?
I think I'd kind of been doing some yoga too, but I think that taking that mental pressure off myself that I don't need to have this high intense exercise every day was the part that I worked on. And and yeah, so I think movement, we just tried to reduce it a little bit rather than like 5 to 7 days, maybe focus on some of those times like a walk or the yoga that you said, and recognizing that that's important too for movement.
I always think too, after like you get different highs from different types of workouts. Like my husband and I went on a 3 mile walk at like 8:45 last night and got back to the house like just before 10. It was a very different feeling I had at the end of that workout than I did a few days before when I weightlifted, which was very different than I had a few days before when I did a spinning class. And then one day I had physical therapy and I was done with my physical therapy and I did all these stretching things where it was like, it wasn't yoga, but it was like kind of some yoga poses and I breathed into them and I did dynamic movement in them. And even just that, I had a different feeling from, and they were all good. but they're very different.
Mm-hmm.
And um, a, a lot of what your body craves is honestly that variety. Mentally, we like less variety typically and routine, but your body kind of craves being challenged in the different ways. And that's a really effective way to um, create sustainable strength flexibility, is like challenging your body in those different ways and not just always doing that same thing. Just because I have a Peloton bike in my basement doesn't mean I should be on the Peloton 7 days a week or even 5 days a week. Um, Access and cost of things can play a major role in the choices that you make. Like we weren't we didn't belong to a gym 9 months out of the last 12. And so I am focusing more on weightlifting right now while we have a summer pool membership at a gym because it's what I have access to right now. And that's
Yeah.
okay. It's okay for you to have that variety with those changes. I'm sure working out in Florida looked a little different than it does in Minnesota.
Mm-hmm.
Working out before you have a baby looks very different than working out once you do have a baby.
Mm-hmm.
Um, and each season can come with its own kind of, you can kind of choose to look at them as benefits and blessings, and challenges to overcome. But that is a piece, at least in my mind, from the practitioner side. I remember feeling like this is a bigger part of your story than maybe what you came into the program expecting me to tell you to do. I remember feeling like, wow, we got to cool down on some of this exercise and
Mm-hmm.
create some sense of safety. Not that you were like severely under eating or severely over exercising, but there seemed like there was a little bit of like we need to dial it down slightly so that we can make sure your body feels like abundant resources here.
Mm-hmm. Yeah. Yep. I think I was kind of learning that maybe I was like overdoing things, and
Mm-hmm.
that kind of that highly motivated person that I kind of mentioned before, I think got in the way a little bit there, and learning to let go and be more still and watch the sunset. That was what I need to dial into more.
So, when we start talking about health changes, supplement changes, medication changes, and cycle changes, how did you see things adjust in your cycle?
Yeah. When I started with the functional medicine, it was kind of just a little bit before you and I met, and I think we went through the recommendations she gave me, and then you kind of maybe tweaked a couple things. But I think that when I started the supplements, that I started noticing my cycle started coming closer to every 60 days. So it was getting closer to the 30 days we were hoping for. But for a while I didn't get it. So it started to, semi come. And then I also noticed, watching my cycle, which I used, Read Your Body app. I don't know if you've talked about that.
Yeah.
Yeah, but it was really insightful because you can really look at these different components and analyze yourself and become more familiar with what your body's doing. And so we kind of started to see patterns with what we were doing together. And I think it's kind of hard to measure the hair growth, I think, but the cycles were starting to slowly come together. But when I did get pregnant, it was on a expected 57 to 60-day cycle. So I never got there. I never got to the 28 to 35 days before I was pregnant, which I know, I talked to some providers and they were kind of like, "Are you sure?" And I'm like, "Yes, I'm sure."
Here are the
Um,
temperatures to prove it.
yep. Hmm.
Yeah, and I think that that is a really common misconception amongst even OBGYNs that work in women's fertility cycles, prescribing medications. It's because we just, in the general progression of childhood into adulthood at home and in schools. We aren't really taught about this. Some churches talk about it more than others, about cycle literacy and kind of understanding your cycle. But unless you're really dialed into somebody that this has been important to, you may not have had a preview into that. And so most people, if they know anything, think cycles are 28 to 30 days. You ovulate around day 14. I've heard OBGYNs say all women ovulate on day 14. I had one say that to me when I was telling her I had a 60-day cycle. And I'm like, I can guarantee you. Because then if that's the case, I'm getting pregnant every single cycle and miscarrying, like it just doesn't make sense when you understand hormonally, physiology, like all these pieces that combine for what we expect to happen. And people are often told if you ovulate later in your cycle that it's not a healthy egg. It won't be viable for pregnancy. And that's not necessarily the case either. I mean, my first was also a very late ovulation in a cycle that would have been a very similar length. Very healthy child, very healthy pregnancy. What often happens, and alluded to earlier in the episode, is that you can, with PCOS, see like multiple patterns of very fertile cervical mucus come and go. 2 or 3, 4 days of really great fertile cervical mucus, and then nothing for a few days, and then it comes back. And if you start learning more about cycle literacy, if it's coming back, you didn't ovulate. But if you're looking at your temperatures too, you can tell that you haven't ovulated. And so if you see this fertile cervical mucus again, it is worthwhile to continue concentrating sex in that period of time if you're trying to get pregnant. And what you're often seeing is one follicle kind of getting ready, trying to ovulate, and for whatever reason, it doesn't get there. And then the next follicle kind of gets tapped and put in the show. And for a lot of women with PCOS that have these 45 to 70, even 90-day cycles, very often I find that they are ovulating. We can confirm that. And, not everyone loves talking about their own intimacy patterns, but I can tell you, having been the practitioner on the other side of this, if you're having sex once a week, once every other week, or even twice a week, it can be really hard to hit those fertile windows in a 60 or a 90-day cycle. Or if you see multiple patterns of fertile windows, to think that you got it, we had sex in that fertile window, and then kind of be like, okay, we're good. Then your period never comes, and maybe you kind of have stopped paying attention to the signs and patterns. So, Callie's a really good example of continuing to try within that cycle, because had she not, then maybe this beautiful baby wouldn't be the baby we're looking at these days. Might be a different baby in a different cycle, but it's not the one that Callie got to bring home.
Yeah. Yep.
Hey, it's me again, Sophia Pavia, registered dietitian nutritionist specializing in women's health, fertility, and optimal progesterone production. And I'm interrupting an episode of my own podcast to tell you about my online course called Ovulation Unlocked. So if you've been listening to our podcast episodes, you've probably heard a lot of things about basal body temperature, cervical mucus, cervical position, and tracking your fertility. Well, I have designed a 90-minute self-paced online course, which I titled Ovulation Unlocked, that puts all of that together and teaches you how to be the expert on your own fertility from home. This course is designed to put you in the driver's seat of your own fertility, not only so you can know what's going on with your body on any given day, but so that if you need medical help, you can show up to the appointment informed and ready to communicate. Too frequently, us women show up to our doctor's appointments and just say something like, I want to have a baby. And the doctor looks at you and says, good for you. Stop using birth control, start taking a prenatal, come back in a year if you're not pregnant. And that's all we get. However, Ovulation Unlocked puts you in the driver's seat, puts you in control of your fertility, to where if you need help, you can show up to that appointment informed, and ready to communicate your needs. So if you want to become the expert on your own body and your own fertility, head on over to my Instagram bio and tap the Ovulation Unlocked link today.
So tell me what this transition looked like from trying to conceive to pregnancy with PCOS and postpartum with PCOS for you.
hmm Yeah, I think so. I think you mentioned a little bit that when I did get pregnant, it was in the middle of our groups, and I was a little nervous to share that with our group members because I knew people's stories at that point, and I didn't want to, um, I don't know, have someone negatively reflect in any way. I was just really aware of their feelings and their stories. But I did become pregnant and I was excited. I also carried a lot of uncertainty too, and kind of something inside of me, I'd kind of focused a lot on getting my cycle straight. And then it it occurred that we thankfully were able to have a positive pregnancy test. And then it was like, oh, okay, well, that it worked, and now what? And so I was filled a bit with some ambivalence about what does this mean, and is this something, I want to preface it by saying I'm very aware of people's journeys, and there's some women that are still trying to become pregnant, and I want to say this very respectfully, and very aware of everyone's journeys on this. But part of me was like, is this something was this right? Is this something you really want? And never did I think about ending the pregnancy by any means. That's not what I mean. But what does this mean? Am I supposed to be a mom? And what is life going to look like? A big theme that came up for me was identity throughout pregnancy and postpartum, and just that transition of what does that mean to be a mom? And I was able to connect with a therapist um, about last summer, and it was kind of in anticipation of hoping to get pregnant one day, and it turned out I was pregnant by the time I started therapy. She's been really a great therapist to work with, and I touched base with her about once a month. So it's not a big time commitment, but someone I'm able to touch base with. And then postpartum, it really was really helpful having her to talk through these things. But talking with her and then with friends and family, learning about all these different identities that moms can have and what it means to be a mom. Um, so that was a big piece for me. Becoming pregnant was this kind of mental ambivalence or uncertainty, and that carried into postpartum. Um, and then I feel like it still comes up now, being about 4 or 5 months postpartum, but I feel like I've learned a lot, and having that therapist really helped me work through those themes that I was struggling with.
So wonderful. And from a patient perspective or client perspective, however we talk about it, to being the practitioner side of that, you have a unique window into what therapy and mental health, healthcare, the incredible need for it. And I'd
hmm
love for you just to have a voice in this moment on either side of the equation, to now having lived through infertility, pregnancy with PCOS, having a child, and being a mom, going back to work,
hmm
um, being a teenager, offered a prescription like birth control. Like, do you have thoughts or reflections on or encouragements for somebody listening to this if they were in any one of those stages, and what a mental health professional could offer for them?
Yeah. Yeah. And I will say that there are health providers out there from state to state, city to city, there's a variety of people. So having a poor experience with one doesn't mean that you can generalize that to everyone. There are providers out there that get it, and providers out there that want to listen and want to learn. And if someone doesn't have all the information, find someone that's willing to work with you to find that information or be there for you along the way and sit with you in the mix, because there's some things that we just don't know. Um, but I hope I was able to kind of keep looking for things, looking for providers that I felt comfortable with. I felt kind of worked with me, listened to me, validated me, partnered with me. Um, and so I just want to have that as like hope that there are providers out there. And I also feel, so I'm a psychiatric nurse practitioner, and part of my role um, is medication management for individuals with mental illness. Additionally, as a nurse practitioner, specifically in psychiatric mental health, I do and can provide some therapy too. Um, there are people out there that are advocating for practitioners to look out for individuals who have PCOS. I listened to this continuing education all about a psychiatrist actually that said, let's look out for these symptoms because there are some individuals with depression, anxiety that come in and they've tried everything for depression, anxiety, and they can't figure out how to get better. And he encouraged the providers to become familiar with PCOS specifically, in addition to two other diagnoses, and say, be on the lookout for these things because these can look a lot like this. Walking through this journey and also becoming in the stage of life, I've watched a lot of my friends deal with infertility, postpartum anxiety, postpartum depression, miscarriage, and I really started learning about the gaps in our healthcare. And so for me, as a mental health provider, I really wanted to take a look at that community of people and ask the questions like, how can I help? So I did obtain a certification through Postpartum Support International, which is a really great resource that I'll plug for women in the and lots of different people, I should say, in the pregnancy, in the fertility world. So I do have a certification now that can work with individuals going through fertility specifically and recognizing how mental health can be impacted by these events. I was also inspired to take a more look at integrative medicines throughout my experience as well, using acupuncture, supplements, exercise, and I was able to do a fellowship in reproductive psychiatry, specifically looking at integrative modalities. And so that was inspiring to me walking through um, kind of, I took what I was going through and adapted my career to start focusing more on these things. I kind of took a little different spin on that question, Caitlin, but
That's okay. I think
hopefully
it's
you can use
helpful.
that too.
Yeah, and I do have to say, I think one of my many strengths slash weaknesses is seeing business opportunities everywhere and needs everywhere and trying to be like, here's a hole. And I like very much feel like when I met Callie, I was like a fisher with a fishing rod being like, we need you in the PCOS community. We need you in the infertility community. Now you've lived pregnancy and are in the midst of your own postpartum. Is there one community that you've now been a part of personally that you're like, man, someday I can't wait to have all my patients or most of my patients be in this bucket because I am just so drawn to loving them and supporting
Hmm.
them.
Yeah. Um, that's a good question.
And the answer can be
The
all of them. I mean,
Yeah.
it's the spectrum can be broad. I just wonder if there's one that you like. I'm very endeared to the infertile and the
Hmm.
postpartum. And I
Hmm.
think part of that for me is very much because those were the hard parts for me. Pregnancy
Hmm.
wasn't so hard for me. I really struggled in postpartum. And so I'm like, if I see a mama, I like pounce. I'm like, how can I love you? How can I hold your
Hmm.
baby? What meal can I bring for you?
Yeah.
I'm just drawn to that. And I wonder if there's something that lights your soul up.
Hmm. I think one thing that comes to mind is just the whole thing, the whole process. Pregnancy is probably one of the hardest things I've gone through. The getting pregnant, the pregnancy, the postpartum, for a number of reasons, the identity shifts, the transitions of living, the ways of your day to day, mentally, physically, spiritually, everything has been it's been a hard year, I guess, and it's been very giving year too. But I do think that not enough attention, kind of going back to seeing my friends go through different things with fertility. I just think there's a space that I'd like to serve in to help in the whole journey, because not only are you physically changing and getting bigger in pregnancy, and then obtaining or um, being gifted a child, but there's a whole biological thing that's going on with your brain, and it puts you more at risk for things like depression, anxiety. There's tons of changes, like if we want to talk about science, tons of changes that go on that can lead you to these things, um, psychologically, emotionally. And for many people, it's like one of the most pivotal times of someone's life. And I just think there's not enough people out there that give women that time and that recognition. So I think for me, kind of similar to you, I guess the journey of maybe the pregnancy to postpartum, my heart goes out to people going through that. And then I think PCOS too. I think that when I was mentioning about the psychiatrist says we need to be on the lookout for people with PCOS, with women with PCOS, PCOS can also bring a lot of mental health challenges too. And
Amen.
yeah, and it can be a huge piece of why we develop anxiety, whether it be worried about our hirsutism on our face, our weight, depression. I mean, having that change of energy with insulin resistance and having those crashes can lead to depression. So it's always so tricky to figure out like what's what. Could it be both things going on? Um, I think our PCOS can kind of look at our self-worth too, or our self-concept, our self-identity, our self-esteem. And so that's one reason I really like working in the mental health field. And I think finding a practitioner, again, whether it be a therapist, nurse practitioner, and psychiatrist, finding someone that really looks at a holistic perspective is a really big bonus for you in being able to recognize how those different concepts can mold you to how you are experiencing life today. Um, so hopefully that made sense.
It does. It totally does. I think we're going to get like 40 million emails of people being like, how do I work with Callie? So could you tell us
Hmm.
what your license covers and where, so we can first of all allay the people that know for sure they can't work with you, but then the people that might fit that criteria and want to,
Yeah.
I can pass your information personally along to them if that's something they're interested
Yep.
in.
Yep. Yeah. And so just right now, last summer I was thinking about this. I know we had a conversation because before I worked with you, I started thinking, how can I work with women with PCOS and mental health? And I think you also like thought that too, so it was kind of a cool God moment. And then I started thinking about one day maybe doing a private practice of some kind. And then I became pregnant, and that is now put on hold um, for a variety of reasons.
Very understandingly so. Right. And
Yeah.
that's okay. And if you
Yep.
never do that, it's also okay.
Mm-hmm.
You can serve people right where you are.
Yep. Yep. But I've advertised myself to like working with reproductive psychiatry and women's health. And so I currently work in Minnesota. And if you're interested, reach out to Caitlin and she can connect us. I primarily do medication management for people. But again, I'm somebody coming from the nursing background. I like to say nurses like to take a holistic perspective and look at mind, body, spirit. And I'm very open to integrative therapies and making those recommendations to people. I can offer some supportive therapy, and one day I may end up taking on therapy patients, but right now it's more of the med piece. And I also am somebody that never pushes meds. I always look at medications as a tool. And then I offer things like, let's work on your sleep, making sure you get some good nutrition. And I pull Caitlin's, I've I've referenced Caitlin before and I've sent people to your page, but try to reference that protein base, the healthy fats, the balanced diet
Gonna help
as a,
everyone.
yeah, and that's a huge thing for your mental health in general. Um, so that's kind of what I do and how I go about my practice. And so every practitioner is a little different, and I just encourage people if you haven't found someone that you align with or connect with, keep looking. And it can be a long, expensive journey, so it can be discouraging. Because it's not super fun to go to all these appointments all the time and find the time to do it. But for a lot of places, there's good bios out there that you can kind of read up and see what they're like. But right now, I just work in Minnesota, and then maybe one day I will branch out and be able to serve people outside of Minnesota. Um,
Stay tuned.
Stay tuned.
You know, if she does, that I'll be the first one preaching her name from the
Yeah.
rooftops. So
Yeah.
maybe just stay
Yeah.
connected to me and you'll know.
Hmm.
Well, Callie, I feel like you have earned your yeah girl moment. You are on an episode. We have reached the end. I want to thank you for your generosity and sharing your story. And I want to give you the opportunity to celebrate something, anything, big, small, personal, professional. I'm here for it.
Yeah, I think, well, I think, let's see.
You want me to go first and you can think?
Yeah, yeah.
Okay, today, actually yesterday, I took my kids to the pool and it was summer and warm and I had all three of my kiddos, which two of them swim very well. One of them's in like I don't even know what you call them, floaty thing. And they're all jumping in the pool from the side and it's very busy, very fun YMCA pool. And it was just like this moment of just like appreciating summer and approaching it with I don't see, I would much rather live in winter, maybe not Minnesota winter, but like I like the cold, cozy, give
Hmm.
me a soup, give me a book and a fire. I don't love the hot so much. But I had this moment of just being like, this is delicious summer. This is like what summer is meant to be. And I just was like, this is the best. And I was so happy at the pool, watching kids jump in and kind of literally living my life stream, like stopping and smelling the roses. It smelled like chlorine at that moment, but I was really appreciative. So that's my
Hmm.
moment. My
Yeah.
yeah girl. It was a
Kind
good
of
summer day.
gratitude and
Yeah.
just being where you're supposed to be.
Yeah.
Yeah. Yeah, I guess one of the things that I struggle with is saying no to things. I like to please people. I like to be accommodating and um although I would have liked to do this, I had to say no to a friend wanting to get together. And it was something that I really wanted to squeeze it in, but I know that right now life is busy and I had to just say no, but let's stay in touch. And so I think just being able to say no is a yeah girl for me since it's hard
Totally.
and kind of
Totally.
practicing that stillness and
Yeah.
pacing myself.
I love that.
So, yeah, that's my yeah girl moment.
I'll
And then
take
also
that.
just being on the podcast. I've never been on a podcast before, so it's been
Yeah, girl. So
yeah.
fun. Is it weird,
Yeah.
but behind the scenes, like, oh, we're just having normal conversation?
Yeah. Mm-hmm.
It is a
Yeah.
little.
Yeah.
Well, I
It
can say
mhm.
you sound very seasoned. You sound like you've done this. You're a very thoughtful speaker. You don't, your words are packed with intention, I can tell. And so um, it's going to be a great episode for people. I'm excited.
Well, good. Yeah, I hope it's helpful for someone, and I know the podcast was helpful for me, so I hope
Yay.
it can help someone out there.
Okay, well, this is another episode of Food Freedom and Fertility. Thank you again, Callie, for sharing, and we'll see you next week.
Hey, it's Sophia. If you love the show and want to continue your health and fertility journey using our resources, head on over to foodfreedomfertility.com for show notes, links to products and services, information about our guests, and our newsletter. Again, that's foodfreedomfertility.com. Thanks for listening.